Spirituality is basically what what reasons we give to whatever has happened to us. Like for instance, uh, a patient might be diagnosed of a disease like cancer or any other life limiting illness, and after the diagnosis, he or she might have several reasons that she might think are the reasons as to why she got sick. For example, the patient might think it's because of something she did, wrong she did. Yeah, she might think it's because of an agreement or a tradition he or she didn't fulfill. Or the patient may also think the disease is secondary to witchcraft. So all these type of pains are manageable, and the management of these types of pain is categorized into two. There is the pharmacological management and the non-pharmacological management. Today I'll major on pharmacological management of pain. So I will simply use the WHO analgesic ladder, which has three steps, and there is ladder 1, ladder 2, and ladder 3. And recently there was an update whereby they said also ladder 4. There is also a ladder 4. So for ladder 1, you use a ladder 1 pain management plan to manage mild pain. Uh, Before we manage pain, we need to remember that we need we need to measure and also assess the pain to get a clear picture of what the patient is going through, because pain is not managed in the same way. Some pain might respond to some drugs, others might not respond to some drugs. And also there is also some disparities in management of pain between adults and children. There are some drugs that you cannot use for children because of the prematurity of their river. And I start with the mild pain. Basically, this is the pain that the patient rates on a linear scale at probably 4 and below. And this type of pain is managed using the non-steroidal anti-inflammatory drugs. And also, these are non-steroidal anti-inflammatory drugs are drugs like paracetamol. You can use drugs like ibuprofen. Ibuprofen is given 400 milligrams 3 times a day. Paracetamol is given uh, 1 gram 3 times a day to a maximum of 4 grams in 24 hours. And in the management of pain, there are also other drugs that are used called adjuvants. These adjuvants are drugs that are not purposely for pain management, but they play a role in pain management. An example of an adjuvant is like steroids, a drug like dexamethasone. It can be used in for example, in a patient who have cancer, and maybe this cancer is causing compression of nearby organs. It will help treat the pain because it will shrink the bulky tumor. Other drugs used for pain management and are not specifically for pain are drugs like anticonvulsant drugs, for example, carbamazepine. Carbamazepine administered at a dosage of 100 milligrams twice a day. You can also give tricyclic antidepressants. Drugs like amitriptyline are very effective in management of neuropathic pain. The policy to shift to the next ladder depends on the patient response. If we need to understand that as pain managers, once you give a patient a pain medication, you need to reassess the patient to find out whether the treatment was effective. Happen to reassess the patient and discover that the pain have not subsided, you need to go to the next ladder, which is ladder 2. And this ladder 2 mainly contains weak opioids, drugs like tramadol and codeine. Codeine is given at a dosage of 30 to 60 milligrams 4 hourly. Tramadol is given at a dosage of 100 milligrams 3 times a day. Uh, we need to understand that the ladder 2 drugs cannot be used to manage pain in children. And the reason behind that is because the children's liver is premature, and basically the functioning of these weak opioids, they are converted into morphine by an enzyme called glucose 6 phosphate dehydrogenase produced in the liver. And once they are converted into morphine, that is when they take action on the pain. So in children, this enzyme is insufficient, so the children cannot be able to transform this drug into their active form, which is morphine. So we should not administer such the other 2 drugs to children. Uh, the other after management using ladder 2, if you happen to find out that the pain is still existing, you need to go to ladder 3. And before we go to ladder 3, I've forgotten something, that for children, mild pain and severe pain is managed both using morphine, no other drug. You give morphine. So let's go to ladder 3. And ladder 3 mostly is constituted by strong opioids. A drug like uh, morphine, and morphine comes in different forms. There is the injectable morphine and the oral morphine. The one that is mostly administered is the oral morphine, because the injectable morphine has side effects which are at times difficult as a patient to deal with. And other drugs that can be used, morphine is given 4 hourly. And you also need to understand that while administering opioids, a very important component or a drug that you should include in every prescription of an opioid is a laxative. You can give lactulose or bisacodyl. Uh, for morphine, it's given 4 hourly, and there are different side effects of its administrations that the caregiver need to understand. That morphine can cause nausea and vomiting. It can also lead to myoclonus. Myoclonus is basically jerking and having irregular tremors in the body. It can lead to constipation. And an overdose can lead to respiratory depression. So it's good, at least to administer for patients who are beginning morphine. Let them get a prescription of also a laxative, an antiemetic drug. You can use drugs like metoclopramide, or you can use drugs like so the other drugs that are used are oxycodone and methadone. These are not commonly used because they are mainly administered by specialists because of their unlikely side effects. They are strong drugs. So recently there was invention of ladder 4 pain management, which was the use of nerve blocks. And nerve blocks have been used management of malignancies. For example, abdominal malignancies like pancreatic carcinoma, whereby you can use a lumbar block. These nerve block, they are basically kind of an analgesia that is administered by blocking the sensitivity of nerves that supply a certain region. We can know, in our anatomy, we all understand that the nerves that supply each region of our body, they originate from the spine in the different region. There is the thoracic, the lumbar. So the pain manager will target the nerves that supply a certain region that has been affected by a disease. Uh, Additionally, before I end the session, I also need to emphasize that for management of pancreatic pain, pancreatic pain, I mean pain that is as a result of a condition that is affecting the pancreas. It can be a malignant or an unmalignant condition. Like for instance, a disease like pancreatitis. I know pancreatitis is not a palliative condition, but tramadol has shown great results because it has the effect of relaxation of the sphincter of Oddi, and so it's of essence when such a condition is diagnosed. So there's been pressure sharing these sessions. Uh, I'll be sharing more sessions, and as time goes on, because we need to enlighten and show the public that regardless of whatever condition you've been diagnosed with, whether malignant or non-malignant, there is always something we can do, and cancer diagnosis is not a death sentence.